Hi, my name is Paul Neilsen. I lead strategic partnerships for Optum Technology. Optum is a company within the United Healthcare group of companies, and it's the largest healthcare provider in the United States. I'm happy and honored to be speaking to all of you as you're all in an area that I spent 25 years of my life in, and that's in startups and the entrepreneurial community. So just to give you a little bit of background, I have a computer science degree. I graduated from the University of Massachusetts in Amherst. And as I mentioned, as soon as I graduated, I went into a startup. And then from there, I just went to another and another. And really, I spent I was at six startups over 25 years. I had all the experiences, good and bad. One company that we self-funded, we took public in 3.5 years. And a couple of companies were purchased for pennies on the dollar. So nobody really made any money, but we all ended up in very good companies. We were acquired for the technology we had. And then several other companies, just came to the end of the runway, and there wasn't a next day, so to speak. We just couldn't get to the product to market and get the product market fit at the time. But all of those experiences, good and bad, are good, because you learn from those experiences and you take that learning and move forward with it. So that being said, I find myself now 6 years with Optum Technology. As I mentioned, we're a very large company. We're the largest healthcare provider and payer in the U.S. From a technology perspective, we deliver over 500 applications to the healthcare marketplace in the United States. We're the largest software provider in the healthcare industry, which is a little known secret in the industry. And as I mentioned, my role is to find strategic partnerships that can help accelerate our digital healthcare transformation. And you are all here to talk about, or here, I should say, the future of healthcare in the digital world. And I'm hoping that what I can share with you today can help you in that journey. So, on that subject, we've been on a transformation agenda and journey for the last 5 years or so, maybe longer, where we're trying to automate, digitize all aspects of healthcare: the back office, claims processing, claims adjudication, prior auth, all the way down to the clinic, where we're trying to create tools and means to assist the clinician in the exam room using artificial intelligence, machine learning, NLP, ambient technology, so that we can help the clinicians make the best informed decisions on the next step for that individual's healthcare journey and how to address a particular condition. AI is a huge part of that. As we move into the digital domain, I see the greatest change in care delivery will be delivered via telehealth. And telehealth in itself is a really broad subject. COVID, as we're all living through this today, and as it's become endemic, we'll be continuing to live with this into the future, really took down the barriers that we had in regards to telehealth care delivery services. There were many regulatory restrictions. There was also lots of concern about privacy and data. And with COVID, where we all had to shelter in place, and all of us around the world had to do our share in terms of trying to bring flatten the curve, bring the pandemic into some phase of control. More and more, we had to deliver services remotely. We could not go to a clinic, a physical location. So with that, the health systems, the health providers, hospital systems, health companies like ourselves went on a very fast, rapid journey to create telehealth services where we could do urgent care visits remotely into the home, and now wellness visits, remotely into the home. And we do that through digitalization. We do that through IoT devices, wearables. We do that through ambient technology, Google Home, Apple Home, Nest, all these things now can capture information that can help us determine the condition of an individual in that setting. We're doing that through building kits that we can send to the home that are clinical grade and can capture biometric information such as blood pressure, temperature, these connected devices that then are transmitted in real time back to the clinician. And then that data is analyzed. And so the clinician can determine what state the individual is in and make a diagnosis. To make that diagnosis requires artificial intelligence, requires machine learning, natural language processing, computer vision. All of those things come to play here. So that being said, there's a tremendous opportunity for all of you here who are in startups or entrepreneurs or innovators to really drive the direction of the next generation of healthcare. If you think about innovation, innovation starts where you are. It starts with one or two people sitting around talking about a problem and coming up with a solution, and then putting in the time and effort to take that idea and create a minimal viable product, and then go through the product cycle of testing that for market fit, and then finding obviously customers for that product. But it really starts there. Large companies like ourselves, our innovation, we are constantly striving for innovation, but we have to do it with partners like you all here at NASSCOM, because we still have this huge enterprise to operate, and it's very hard to interrupt that or to dedicate the resources to innovate while you're managing, a large operation, delivering care services every minute of the day to your existing membership. So we have to rely on the startup community, the innovators, and the entrepreneurs in the industry. And with that being said, some of the things we do to support that are Optum started the Optum Startup Studio 3 years ago in the United States, and that's an incubator for early stage healthcare related startups. We're working with our partners in India to create the same concept there, and so that we can tap the huge resources that you have in India in the entrepreneurial innovation space. Where we partner with research institutions, and you have some of the world's best, double IT, triple IT, and here in the U.S. we have Carnegie Mellon, MIT, Stanford. We work with Trinity College in Dublin, which is also well known for its AI. We partner with the PhDs, the PhD candidates, the research professors on innovative ideas around healthcare, working with leading edge technology. And then, of course, we partner with industry as well. NVIDIA, Google, Microsoft, companies that have capabilities, platforms that can help enable a digital solution, help you rapidly bring something to market. NVIDIA is the leader in GPUs, which are core to running machine learning algorithms or computer vision. So all of these things build the ecosystem for innovation. And here at Optum, my role has been to partner with the ecosystem and with our internal business unit and stakeholders so that we can bring this next generation digital healthcare to the market. I in many ways envious of where you are. That's where I started now it's 30 years ago. I love the innovation space. It's really fun. It's fast paced and exciting, and you can bring real change. Healthcare, in particular, what you do impacts everybody, yourself and everybody around you, everybody in the world. It affects the quality of our life and how long we live and how well we live that life. So what you do is extremely important, not to minimize what innovation occurs in digital retail or other industries, but this is all about humanity and how we create an environment and services so that we can live better, longer, healthier through our lives. So with that being said, I just want to wish you all a great conference. Good luck in your endeavors. A failure isn't a failure. It's a learning event. Take what you learn there and apply it to the next attempt, but keep trying. And then perseverance is the most important characteristic of an entrepreneur. Just keep trying. Thank you all. Have a great conference.